So thank you, Darren, for the introduction. As most of you probably already knew, I spend most of my time during the day at the Women's Center, doing my daytime duties as the security manager, doing non-directive pregnancy options counseling with patients, and I also take care of a lot of the sort of informal IT things and managing our volunteers to make sure that our lovely protesters are doing what they're supposed to be doing. So the reason we have protesters is because we provide abortions up through 19 weeks of pregnancy at our facility. We were founded in 1978, originally in Allentown, so we've been around for a pretty long time, and we do a full spectrum of GYN services. So STD testing, birth control, well woman exams, all of those things. And we're actually in the process of expanding our LGBT program so that we can provide better transitional services to some of the transgender people in our community. And we're pretty excited about that. So I'm here today because we're really, really close to November, as I'm sure a lot of you are realizing. With all the debates and all the hubbub about Romney and Obama, it seems like a really important time to kind of talk about what I deal with having to do with my work, issues that are really kind of near and dear to my heart, and making sure that you know how much your vote this November is really going to affect the issues that we're going to discuss today. So, the war on women is a term that I guess the media coined. And that refers to the really astounding increase in laws being introduced and passed that are provisions on women's reproductive health and their right to abortion. Just over the past 2 years, there's been a really astounding increase. Maybe? So, as I was researching this presentation, this chart was kind of the first thing that really jumped out at me. You can see going back to 1985, they were keeping track of provisions having to do with abortion restrictions that were actually passed into law. And from 2010 to 2011, it's just off the chart practically. It's not something that we've seen really before. And as you can see with the accompanying figures, just from 2010 to 2011, we had a little bit of an increase in provisions that were introduced and enacted, but the percentage of those provisions that restrict abortion access more than doubled. The increase was just ridiculous. And so the Guttmacher Institutes, which is where I really got the majority of my source material, identifies 10 major types of abortion restrictions. And this was a really good sort of skeleton for me to be able to lay these out for you in a way that was going to make sense and was going to be easy for me to explain. So the Guttmacher Institute is a nonprofit organization. They're not tied to any political party or major group. And they basically do research and policy analysis with the goal of advancing reproductive health and reproductive rights. So the first law that I want to talk about is parental consent or notification laws. Keeping in mind the figures here refer just to teens that are under 18 years old, that are minors. So this wouldn't be 18-year-olds or 19-year-olds. But 31% of all those pregnancies end in abortion, and that amounts to actually over 100,000 abortions a year in teenagers. These laws tend to come up because of the fear that teenagers can't make decisions on their own, that they should have to notify parents and that the state should be responsible for making sure that they do that. But 61% of teens, we know from studies, voluntarily will notify at least one of their parents, possibly two. And when you look at teenagers that are under 15, that figure actually jumps to 90%. So the remaining 39% have really, really good reasons for not informing their parents, and they're really unfortunate reasons. You can see they're worried about being kicked out of their house, they're worried about physical abuse because they've been abused before at home, or we run into this at the Women's Center sometimes where we see a patient who's a minor who doesn't really know where her mom is, her father's incarcerated, and she lives with her grandmother, who's actually not her legal guardian. So for her to obtain consent for an abortion is practically impossible. That causes her to have to seek what's called a judicial bypass, where we have to take her to the Northampton County Courthouse and have her meet with a judge so that the judge can determine she can make this decision for herself. Less scary than it sounds, but the courthouse is open really only during the hours that this 14-year-old is in school. And she doesn't drive, and she doesn't have any way to get here, so it becomes a huge barrier. And even before she has called us and she has gotten to us to try to pursue care, it creates delays because in many cases, the power of denial in a minor is just amazing. And they don't realize they're pregnant until they're 12, 13, 14, 15 weeks. And then they have to go through this whole judicial bypass process, and it pushes the procedures off later and later, making it more expensive and endangering young women's health. The other thing that sticks out here is these laws only single out teens who choose abortion as an option. You can go seek prenatal care as a 14-year-old without your parents' consent. You can start the process of making an adoption plan without your parents' consent. But if you specifically want to choose abortion as an option, Pennsylvania does require that you obtain consent from your parents. We have something called the Pennsylvania Abortion Control Act law, which requires parental consent and notification, as well as a 24-hour waiting period between the time that the minor and her parent get a specific set of state-required information and the time that she can obtain an abortion. So that brings us to the counseling. 32 states have this mandate, as I said, PA included. And this counseling is something that is written not by doctors, not by medical professionals, not by actual counselors, but by legislators who have a really important agenda. This usually includes, as in PA, a list of possible but rare complications that could occur but basically never do from an abortion, without mentioning that childbirth is over 15 times more dangerous than a first trimester surgical abortion. They talk about fetal development. They speculate about whether a fetus can feel pain depending upon the gestational age of the fetus. And they actually assert in some states, thankfully not in PA, but in some states, the risk of post-traumatic stress disorder, which the anti-abortion people like to call post-abortion syndrome, which is obviously not an American Psychological Association recognized disorder at all. Suicide, depression, other psychological injuries. Something that's been circulating since Roe v. Wade was passed and before is that abortion increases a woman's chance of developing breast cancer, which it's an annual thing that Harvard Medical School publishes another paper. Just so you guys know, we'll remind you, abortion and breast cancer have no link at all whatsoever, but you know, the protesters still carry their signs. And they also tend to write in the legislation that a woman's pregnancy is her unborn child and require that she be given information about child support and the ability of her to get Medicaid benefits. In Pennsylvania, they do require that this information be given by a doctor. And that becomes a problem because any of our telephone counselors would be perfectly capable of giving this information to a patient. But instead, we have to pay our doctor to sit on the phone or in person and give this information to every single patient 24 hours or more before her procedure. And of course, that drives up costs, and it takes away time from the doctor that he could be giving direct care services to a patient. I think the biggest problem with it, and with any laws that require the medical staff to do things that the state wants them to do, is that it really undermines the doctor-patient relationship. In most cases, this information is not something that the physician thinks is necessary for the patient to know. The patient probably doesn't want the information at all, or she already knows it. And the state kind of uses the doctor as a puppet to further whatever political agenda they're trying to further. And obviously the whole purpose is just to make women afraid and discourage them from getting an abortion. So there's also laws across the country that require patients to make multiple visits to the clinic in order to get a procedure. So 26 states, again including Pennsylvania, state that all this counseling that we've been talking about be met some minimum number of hours before the procedure, and this often has to be done in person. So a figure that I think startles a lot of people is that 87% of counties in our country don't have an abortion provider. And that leaves a lot of patients driving 50, 75, 100 miles to the clinic and back home, then waiting 24 to 72 hours and driving that same distance back again. This is something that creates huge barriers, especially for women in rural areas, women who live in poverty, because they may not have a car, they may not have paid time off from work, they may not have child care. And especially for women in abusive relationships, this becomes a problem because it's often hard for them to get out of their house just for an hour without someone wondering where they are, let alone 2 separate visits, drive 2 hours, appointment for 3 hours, drive home 2 hours. Basically, the purpose of this is to delay procedures, to make them more expensive, to make them more difficult so that women have reduced access to services. And again, there's no other type of medical procedure at all whatsoever that the state comes in and requires you make multiple visits to the healthcare facility except for elective abortion. So everybody remembers, I'm sure, the Virginia ultrasound bill that we heard about in the news. But Virginia is not the only state that has a law like this. 9 states actually have them on the books and are enforcing them. And several other states, actually including Pennsylvania, are considering their own ultrasound bill. Ours is HB 1077, and after the whole Virginia ultrasound explosion, they tabled it. But it could be reintroduced anytime they feel like they want to bring it up again. Now, the bills, as in Virginia, a lot of times mandate that you have to use a vaginal probe for the ultrasound in order to get a clear image early in the pregnancy, which is really invasive for women. Some states allow women to opt out of that and just do the abdominal ultrasound, but some states don't. It tends to include that the ultrasound technician give a really, really exhaustive, detailed description of the ultrasound image. Women are often required to listen to the fetal heartbeat and be given a copy of the printed ultrasound whether or not they want it. Then in some cases, this gets wrapped up into the 24-hour or 72-hour waiting period. So they have to drive to the clinic, get the ultrasound, go through this whole affair, and then they have to wait. So the states that require this don't fund the tests. And this is not a medically necessary ultrasound at all. So even if you've managed to get an insurance plan that covers abortion, they're not covering this ultrasound because there's no reason that you should have to do it. So, you know, that could be, depending on where you get it, $100, or it could be $400. And something to keep in mind is that clinics already perform ultrasounds. Every woman that comes in to us for a surgical procedure gets a minimum of 2. One for gestational dating, and then all of our surgical procedures are done guided by an ultrasound. So the additional ultrasound is like an absurd requirement. And again, it very much undermines the doctor-patient relationship to force a medical staff at a clinic to supply women with information that they probably don't need to make their decision, and in almost all cases don't want. Now, I don't know if anybody saw this, but Governor Corbett was asked about his thoughts on this bill, so I thought I would share them with you. I hope this is loud enough.
And I apologize if you've already said publicly, where do you stand on that ultrasound bill that seemed to kind of stir things up in the House?
Well, I mean, we made a statement during the campaign. I wouldn't change it, as long as it's not obtrusive. But we're still waiting to see.
Making them watch and speaking with them, does that go too far in your mind?
I don't know how you make anybody watch, okay? Because you just have to close your eyes. But as long as it's on exterior, not interior, okay?
So you just have to close your eyes. The PI ultrasound bill requires that the ultrasound monitor be positioned in such a way that a woman is able to see it. So if that's introduced and that's passed, she would literally have to just squeeze her eyes shut if she doesn't want to look at the ultrasound image. So thanks, Governor Corbett. Yes. Well, this was all during this sort of Virginia ultrasound bill explosion. So in Virginia, they passed a bill, the wording of which would have required that women earlier in their pregnancies would be getting a transvaginal ultrasound, because at very early stages in the pregnancy, you can't get a clear picture of the pregnancy with just an abdominal ultrasound. So when PA introduced the bill, he was getting grilled of, are you going to force women to have these ultrasounds with vaginal probes, or are you going to let them opt for abdominal ultrasounds? I mean, either way, I think it's disgusting, but you know, it certainly is better to be able to say that you don't want transvaginal ultrasounds. Does that answer your question?
Yes, it answers the question in the wording.
Okay, good.
What's the current status of that?
It's been tabled. They decided not to vote on it. They sort of pushed it off, and there hasn't been, as far as I'm aware, much talk of when or if it's going to be introduced, but it could be. So you can look it up, or you could call your representative and say, that's not a good idea. Don't vote for that. You're welcome. So the Medicaid is kind of a sticky situation. There's something called the Hyde Amendment, which is really the cornerstone of this class of restriction, and in my opinion, it's one of the most oppressive because it really only affects the most disenfranchised among us. It affects women who are poor. So the Hyde Amendment was implemented in 1977 for the first time after a series of court cases concerning Roe versus Wade and how federal and state money were going to be spent to fund abortion. Now, it's been rewritten several times with things added, things taken away, things added again. And it specifies what abortion services are covered by Medicaid, but only using federal dollars. The states can use their money, that's state money only, to add to the Medicaid coverage or to not. The only thing that the Hyde Amendment requires is that women have to have coverage for cases of rape, incest, and grave life endangerment. So the picture here, you can see the lightest blue there are the states where you're probably going to be able to obtain an elective abortion if you have Medicaid coverage. And as you can see, Pennsylvania is one of those dark states. So if you rely on Medicaid for your insurance, the only way you'll probably be able to obtain an abortion is if it was a case of rape or incest, or that your life is in like imminent danger. So a lot of Pennsylvania women or move to New York or New Jersey, and they have better coverage. This whole system creates huge economic barriers for those poor women. You know, women who are affluent are going to be able to pay for what they need to pay for, but with the patients that we see in Pennsylvania, It may be their first unplanned pregnancy. They weren't aware that Medicaid wasn't going to cover their procedure. And I've had countless patients talk about the choices that they're making between feeding their children and paying their rent and paying for their abortion. They're returning their children's Christmas gifts. They're taking back their Halloween costumes to make sure that they can make this family planning choice and do the best they can for the children they already have. And it's just really heartbreaking situations all the way around. It definitely delays, for obvious reasons, or prohibits abortions for women who don't have the money that they need. And thankfully, we have access to some charitable money where we can do funding for many of these women, but often, if they have to come up with $150, $300, they're still rescheduling 5, 6, 7 times, and it's just raising the costs and delaying their procedure. We're actually seeing an increase over the past 5 years of women resorting to illegal abortions again and self-inducing abortion because of all of these restrictions on coverage and how expensive things are, more so than we've really seen since before Roe v. Wade, and that's really scary. Through a Guttmacher study, we know that 20 to 35%, somewhere in there, of women who continue their pregnancies who live in what we call a non-Medicaid state, meaning a state where Medicaid doesn't cover abortion, would have chosen to not continue the pregnancy if they would have had the option to have that paid for by Medicaid. Now, with those life endangerment exceptions, a lot of states, thankfully Pennsylvania isn't terrible with this, but a lot of states will deny coverage to women with mental health issues, or they require that the physical health concerns must be life-threatening in order to get an abortion. So you're seeing women who have gestational diabetes that they purposefully leave untreated until they're hospitalized, because until they're in the hospital, Medicaid won't pay for an abortion. You know, women who are schizophrenic, who find out they're pregnant and their medication gets taken away because it's not healthy for the pregnancy, and they have to wait till they're admitted to the hospital on suicide watch before Medicaid will pay for them to have an abortion. So this is just a really bad, bad, bad thing for women who are poor and don't have the funds they need out of their pocket to pay for these types of procedures. And that brings us to private health insurance plans. So this is just like a mess of numbers and figures, but basically it breaks down into that 8 states. It doesn't matter what state you have your insurance in, you can't use your insurance to cover abortion if you use it in that state. 20 prohibit insurance plans that are written in the state from including provisions to cover elective abortion. And then 15, including Pennsylvania, prohibit abortion coverage for public employees. So if you work for the state, you can't get coverage. So some states have rape and life endangerment exceptions. Some states don't at all. Now, federal law, this is wrapped up in the Hyde Amendment as well. So you can't get coverage if you get your insurance through the federal government, you work for the federal government. If you are military or dependent of the military, and that's, again, even in cases of rape or incest, TRICARE, military insurance, will not pay for an abortion. Or, of course, Indian Health Services enrollees, Peace Corps volunteers, and women incarcerated in federal prisons. PA is actually one of the better states for women in prison because county and state prisons will allow women to have abortions if they choose to do that. The Affordable Care Act, or Obamacare, as some of us call it, is actually really, really, really bad for abortion coverage. And it gets a little complicated, but it requires that plans that are going to offer abortion coverage have to split up the funds. So the money used to pay for abortion is here, and all the rest of the money for every other service under the sun is over here. And if you buy a plan with abortion coverage, you have to make an entire separate premium payment that they call a rider. So they're telling you that you have to plan for an unplanned pregnancy. You have to preemptively purchase insurance in anticipation that you have an unplanned pregnancy. And to do this, you have to buy what's called a rider, which is amusing because there's no evidence from any insurance company that that actually exists. Like, insurance companies aren't creating that product because there's no incentive for them to do these entire other products that people probably aren't going to buy. So this amounts to women in as many as 20 states not being legally able to purchase a plan with her own private money that covers abortion at all. So medication abortion, which we at the Women's Center use a protocol of mifepristone and misoprostol, and those two medications induce bleeding and cramping, and it allows the patient to kind of have an induced miscarriage at home. There's a couple different ways to do it, but that's the way that we do it. And 39 states, as of this week, Ohio passed some laws regarding this, require that clinicians who are giving that medication out be licensed physicians, which on its face doesn't really sound like a bad idea, but the world over you have advanced midwives, nurse practitioners, PAs giving out this medication, and there's no increase in complication rates at all whatsoever. As long as the patients are following up the way they're supposed to, there's no reason why you would need to have a licensed physician give this medication out. The World Health Organization and the National Abortion Federation have released recommendations that agree with that. And this is what they just passed in Ohio. Several states now require that clinics only use the FDA-approved protocol. Now, that protocol was developed in the early 80s in Europe, and it requires way more medication. It has a large slew of side effects that are really severe. It requires a lot of visits to the clinic. Now, I don't know of any clinic anywhere that's not required to that actually uses the FDA protocol. It doesn't make any sense. It makes it more expensive and more difficult on the patient. And the new regimen it's off-label, which I'm sure many of you in this room might be on a medication that was originally made for one purpose, but we found out it has additional benefits, and we use it for another purpose or in another way, in a different dosage. So there's no other medication at all that a state legislature has come in and said, no, doctors are now not permitted to use this medication off-label. You have to only use it the FDA-approved way. Now, 6 states require that the physical presence of a clinician in order to give the medication out, which is what we call a backdoor ban on telemedicine. So this method of abortion is, non-surgical, it's less invasive, and theoretically it can be done from afar. If you live in a rural area, if you don't have transportation, if you're poor, you can Skype with a doctor, and he can give you all the information you need. You can fax paperwork back and forth, and then he can call that prescription into the pharmacy for you, and no matter where you live, you can obtain an abortion. So this is a new tactic that they're using, saying that the doctor has to physically be in the room and hand the medication to the patient so that they can't do any of the telemedicine stuff. Yes?
Isn't this the over-the-counter?
No, I'm sorry. There's the morning after pill, or Plan B, and that's taken within a certain number of hours after having unprotected sex. So that prevents pregnancy from happening. This is a series of medications that we do it, The FDA-approved protocol says up to 8 weeks. The off-label protocol says it's available up to 9 weeks. That you can take these medications, and it's a way of terminating an already implanted pregnancy. Okay. So another thing that we're dealing with specifically in Pennsylvania is trap laws. So this is the targeted regulation of abortion prevention. Another tactic that's really new and really scary. The people who are trying to push through all these anti-abortion laws have realized that they can do waiting periods, they can require all these visits, but they also have to attack the supply end. They have to attack the clinics themselves. So in PA, we have Act 122, which passed last year. PA had 22 clinics, but after this law was passed, it was an ambulatory surgical center law. 1 closed and 5 stopped being able to do surgical abortions. The rest cut down services, stopped doing anesthesia, stopped doing all these different things because mostly of the physical plant specs that they require. When they passed these laws for facility licensing and ambulatory surgical center requirements, they're saying that the clinic that I work at, which is doing very, very simple, low-risk outpatient procedures, similar complication rates to dental surgery or LASIK eye surgery or electrolysis, has to convert ourselves into a miniature hospital and be held to hospital standards, of course for the sake of patient safety. So really expensive renovations. It's often $1 million or more that clinics are required to spend to get up to spec. And this is a lot having to do with minimum square footage requirements for how big the procedure room has to be, how wide the hallways have to be. Special hospital grade elevators need to be installed if you're on above the first floor. They actually tell you how big your janitorial supply closets have to be. You can't get licensed if those aren't the right specifications. In South Carolina, their trap law actually dictates grass cutting procedures to how tall the grass can be for patient safety. So they'll also require that doctors get admitting privileges at a hospital within a certain radius of the clinic. Not a bad idea, but if you're a clinic that has one hospital within 30 miles of your clinic and it's a Catholic hospital, how are you supposed to get admitting privileges for your doctor that does abortions? You can't. It's impossible. So this is another way that, depending on the geographic location of the clinic, they can shut the clinics down by making sure they don't have an eligible provider to do the procedures. They'll charge big fees, make us jump through huge hoops to get a license. Our director, the process we went through, she referred to these bureaucratic hoops as term papers. So we had to write like a 15-page protocol list explaining to the Department of Health in very specific terms where our staff would go to pee if we lost water in the building. So, you know, all these ridiculous protocols that don't really make any sense. And they require things like, an RN has to be on duty whenever the clinic's open all the time, even if there's no patients in the building. And anyone that works in healthcare knows that RNs are in really high demand, they're very expensive, and they're few and far between. So the point of this is to regulate clinics just out of business, making sure it's too expensive for them to operate, that they can't meet the facility requirements. And it also makes us, allows the state to come in and do searches and inspections. So, you know, we'll just have the Department of Health show up occasionally, men and women with clipboards, and they can feel free to walk around in areas where our patients are in gowns if they want to, which, you know, obviously makes the patients uncomfortable. Some states are requiring now that abortions after a certain gestational age have to be performed in a hospital, even if there's no hospital anywhere that will agree to do abortions in a hospital. So then that, of course, cuts off access for women who are over 14 weeks or whatever it is that they put the line at. So yeah, they're addressing non-existent problems, and it's important to note that all medical practices are already heavily regulated. You know, there's no reason for these additional measures. We get inspected, we comply with OSHA, but there's no laser lipo center that has this level of extra regulation. Restrictions on later abortions are a big thing also. So the Supreme Court laid out how a state may restrict or ban abortion. And in 1973, the big line, the thing they were concerned about was fetal viability. So, you know, you can't prohibit something an abortion that's necessary to save a woman's life. The state cannot determine what constitutes has to be done by a doctor. And they can't require a woman needs an emergency abortion. They can't require that the doctor determining she needs the abortion go get a second opinion while she's in crisis in this medical. So states try anyway to impose restrictions that are unconstitutional. A lot of them have been struck down by higher courts, but they still keep them on the books. So there's different points in the pregnancy where they'll decide to ban abortion. One of the newer tactics, 7 states ban abortion at 20 weeks, even though fetal viability is considered to be around 24-ish weeks, because they claim that a fetus can feel pain at 20 weeks. This is like scientifically a very dubious claim to make because there really isn't any evidence to suggest that. There may be sort of physical stimulus responses to pain, but none of the neural pathways in a 20-week fetus would allow it to actually experience pain the way any of us would, and none of those neural structures develop until well into the 3rd trimester. So this really doesn't make any sense, but they're starting to do it, and a lot of people are viewing it as challenges to Roe, hoping that they'll take it to higher courts and the courts will determine that somehow fetal pain is a compelling reason to regulate later abortions. So, you know, the circumstances on what's allowed varies from state to state, and a lot of states don't have exceptions for life and health and rape and incest. Some of them do, but some of them don't. And then they also have laws that will require a second physician to be present for various different reasons. So a lot of those laws from the previous slide are preemptive bans. So these states are hoping that we're going to get to a point where we can overturn Roe versus Wade. And they want to have laws on the books that when that happens and the control goes back to the states, that they can instantly outlaw all the different things that they want to do. So 20 states have some laws on the books that could be used for that purpose. 7, which I guess is good, have laws that protect abortion prior to viability, or they allow for exceptions in, you know, rape, incest, or life endangerment. Now, aside from the specific abortion bills that Guttmacher lays out, we have a couple of, frankly, just really nutty laws. I don't believe any of which have actually passed, but they've been on ballots in various states. So heartbeat bills are amazing because they state that once a fetal heartbeat can be detected, after that we should ban all abortion. Now, fetal heartbeat can be detected as early as 18 days into the pregnancy. So that's significantly before a woman's even going to take a pregnancy test and realize she's pregnant. Last year, a Right to Life group actually brought a pregnant woman into the House of Representatives and did an ultrasound with audio so that the fetus could testify with its heartbeat as to why they should pass that heartbeat bill. So that was fun. Which would define personhood, meaning being a full citizen under the law, having all the rights of you or I at the moment of conception. So that would ban all abortions, it would ban the treatment of ectopic pregnancies, and it would ban basically every form of birth control except for the condom. Now, Rachel Maddow talks here about a bill that's attached to a name that you might find familiar.
Congressman Paul Ryan, now presumptive vice presidential nominee Paul Ryan, co-sponsored a bill in the House that is a federal version of the Personhood Amendment, the abortion and hormonal birth control ban, the same one that even Mississippi voters rejected last fall. How'd you like it for the whole country? The national personhood bill that Paul Ryan co-sponsored declares that, quote, the life of each human being begins with fertilization, cloning, or its functional equivalent, at which time every human being shall have all the legal and constitutional attributes and privileges of personhood. And they get really specific about when precisely an egg becomes a person. Quote, the term fertilization means the process of a human spermatozoan penetrating the cell membrane of a human oocyte to create a human zygote, a one-celled human embryo, which is a new, unique human being. That's Paul Ryan. That's Paul Ryan's bill. That's who Mitt Romney put on the ticket.
So, yeah. It's progress. So not so progressive would be the justifiable homicide laws, which really terrified me. I wasn't even aware of these until I did some research for this presentation. But they never got on the ballot, but they were in committee in South Dakota and Iowa. It would alter their justifiable homicide laws to allow anti-abortion advocates to kill doctors that perform abortions. And then also wrong birth lawsuit protection. So what this actually does is it allows a physician to lie to a woman about what's going on with her pregnancy. So if there's catastrophic birth defects, if there's some prenatal problem, he suspects that she would have an abortion if she knew about these complications, he can just not tell her. And even if there's records that he knew that was going on, he's protected from any type of malpractice suit. So yeah. And defunding Planned Parenthood is a big one. So we probably all agree that this is real bad, but it's happened in, let's see, Texas, Indiana, and Kansas, and then Arizona, Ohio, and New Hampshire are considering doing it. That's basically yanking all of the Title X funding from Planned Parenthood. Title X funding is what the money that the federal government gives to organizations to subsidize family planning and birth control and all that good stuff. So you can see that little yellow sliver is the amount of services, 3%, that makes up Planned Parenthood's abortion services, 3%. And they already actually have to separate that money out, just like I said before with the Affordable Care Act. When Planned Parenthood gets this funding, they can't use it at all for abortion. So whether we're giving them money or whether we're not giving them money, they're not using federal money for abortion. But when you take that funding away, a lot of times the Planned Parenthoods will have to close affiliate offices, which is going to cut off access for men and women, especially people that rely on Medicaid or who, like me, were a teenager and it was the place where they could go to get birth control before they, you had your own health insurance. And what happens in most cases is either the funds that were going to Planned Parenthood just aren't given out at all, or they go to something called a crisis pregnancy center. I don't know if anybody's familiar with that, but these are centers that look like family planning offices. You may have seen the billboard on 22, pregnant and scared, and it says like 188 Safe Haven. You call there and you say, I'm pregnant, I'm considering an abortion, what should I do? And they say, well, you should come in and get an ultrasound and we'll pray together. And then they tell you that abortion causes breast cancer, and you'll die if you take a birth control pill, and you'll kill yourself if you use the NuvaRing, and all these ridiculous, scientifically unfounded pieces of misinformation. And they don't provide referrals either for birth control or for abortion at all. Birth control. So this has been a big issue this year, and I could do an entire presentation, I'm sure, just on 2011 and 2012 and birth control. But the Cliff's Notes version is that in January, the Department of Health and Human Services announced that we have to cover birth control. It has to be considered preventative health care, and we can't just have plans that aren't going to allow that. So there was the Catholic Bishops Association made a huge, huge hullabaloo about having to cover birth control. And so the religious exemption was made. The Obama administration said, okay, you don't have to provide women with birth control, but we're going to allow women who work for these religiously affiliated organizations to bypass you and get it directly from their own insurance company at no cost to you, at no cost to your employer. That still wasn't good enough for them, but that's where it stands right now. So then that prompted Roy Blunt to introduce the Blunt Amendment, which would allow anyone who owns a business to not include reproductive health or contraceptive services if it violates their moral sensibilities. So if they just don't feel good about it, they couldn't just decide not to offer that coverage. But thankfully that didn't pass. And it was the birth control panel that Daryl Issa convened, which was all dudes. No women on the panel talking about birth control at all. And then Sandra Fluck said, let me speak. I want to talk about why I think this coverage is important. And that resulted in this.
What does it say about the college co-ed Susan Fluke, who goes before a congressional committee and essentially says that she must be paid to have sex? What does that make her? It makes her a slut, right? Makes her a prostitute. She wants to be paid to have sex. She's having so much sex she can't afford the contraception. She wants you and me and the taxpayers to pay her to have sex. What does that make us? We're the pimps. The Johns. That's right. We would be the Johns. No! We're not the John. Well, yeah, that's right. Pimp's not the right word. Okay, so she's not a slut. She's round-heeled. I take...
Who knows? But, slut, prostitute, paid to have sex. I don't know if we're paying for the sex, if we're profiting from the sex. I don't know what we're doing as taxpayers, but it's clearly very bad, according to Rush Limbaugh. Yeah, and then there was that whole pill addiction and 5 divorces. Yeah. There was subsequent, this went on for weeks, where he was saying, yeah, if we're going to pay for her birth control, then she should have to release tapes that we can watch so that we can see what our money's buying. And that was classy. And then one that, my favorite comment about this issue was this guy. And the commentator or interviewer's reaction to this guy. where's my, here we go.
About, and people seem to be so preoccupied with sex. I think it says something about our culture. We maybe need a massive therapy session so we can concentrate on what the real issues are. And this contraceptive thing, my gosh, it's such inexpensive. You know, back in my days, they used bare aspirin for contraceptives. The gals put it between their knees, and it wasn't that costly.
Excuse me, I'm just trying to catch my breath from that, Mr. Freeze, frankly. Let's change the subject to one of your counterparts, Sheldon Adelson.
So, she didn't even know what to do. That's Foster Friess. I'm not sure how to say his last name. Friess? Yeah. He's just famous for being old and conservative. Really. He's a businessman, and you occasionally will see him on a TV show saying stuff like that. So that's what he does. But I saw it and I went, wow.
He was smiling the entire time.
Yeah.
Thinking he was telling a joke.
Yeah, he's adorable. So, that was basically the climate surrounding all these birth control conversations and panels and laws, and it was, women of reproductive age going like, help me, and them going that. So, thankfully, effective as of August, all new plans now have to cover birth. The only downside is it's new plans only. My health insurance plan would be grandfathered in because it was effective before August. So, violence against women. So, the No Taxpayer Funding for Abortion Act, which is another lovely Paul Ryan creation, also co-sponsored by Todd Aiken, attempted to redefine what abortions Medicaid will cover by saying that it'll cover rape, but only if it's forcible rape. Yeah. Well, that's different. That's different.
That's different than consensual rape, I suppose.
I should think so, yeah.
Right.
So the forcible rape would be like a violent rape as opposed to statutory rape. Or if you're an incest victim but you're over 18, not forcible rape. If you were drugged or if you were asleep or passed out, clearly you weren't struggling, not forcible rape. Or if you're a victim of an assault and you have a limited mental capacity and you didn't really put up a fight, and definitely not forcible rape. So none of those would have been covered. It would only be violent assaults. Again, didn't pass, thank goodness. Then a couple months later, we had Todd Aiken opening his mouth again, talking about legitimate rape. So I don't know if everybody knows this, but he's actually on the U.S. House Committee on Science, Space, and Technology. That's one of the boards he serves on. So I really liked the lady parts diagram. This is the romance area. So... So in addition to these sexual assault things, we have VAWA. So the Violence Against Women Act is something that's been around for a while. First introduced in '94. It was this big, celebrated, bipartisan effort. No one didn't like it. Who's not for providing more services to victims of domestic violence? But now in 2012, it's up for reauthorization again. And the bill was rewritten to include services expanding for undocumented immigrants. There's a lot of really unfortunate cases where women who are undocumented are being abused horribly, but they can't get help because if they go to the police, they'll be deported. So this was providing protections for them and also expanding services to LGBT individuals. And that was not okay with the Republicans who were going to reauthorize it. It was painted over the last couple of months as just another distraction, something that's not important. And it's currently actually not being enforced because it wasn't reauthorized. So there's a lot of women who are not getting the services they need because due to a lack of funding, they've closed countless shelters, stopped a lot of programs, and it's just a bad scene for all.